Welcome to another episode of Let's Talk eCommerce. Joining me today, Padam Kafle, a digital health innovator, a super intelligence researcher, and also the CEO of vCodes Software Solutions. As healthcare platform evolve into a full-fledged digital ecosystem, from appointments and diagnostics to payments, subscription, and also remote patient care, the big question emerges: how do we build a scalable healthcare commerce system powered by AI without compromising on data sovereignty and patient trust? That's exactly what we're going to unpack today. Padam, welcome to Let's Talk E-commerce. Super excited to have you here today. So before we jump into the details of the future of commerce in healthcare, I want to set the basics right and, just to set the context as well. I want to understand from you, how e-commerce in healthcare is different from traditional e-commerce wherein we talk about payments, we talk about subscription, etc. So if you could tell me, fundamentally, how does it vary? And according to you, since you have been in this domain for more than 20 years now, it's been 2 decades you have been working in healthcare, building digital products, right? So is commerce in healthcare limited to prescriptions, appointments, buying medicine online, or is it something beyond that is still undiscovered? So please let me know, how do you see this in the healthcare industry?
Thank you, Anurag, for inviting me. See, the 2 decades, yes, so I started my journey from the hospital, so as a techie, and then I moved to the software engineering. Again, there also the focus domain was healthcare, and then again came back into the hospital side, right? So it was kind of a strangulation. So when we talk about the e-commerce, right? So e-commerce, we are talking today not just into the add to cart something, right? So the usually if generally if somebody think about e-commerce, the e-commerce just think, okay, we go to Amazon or Noon and then add to cart and then
Yeah.
get delivered, right? Although now the e-commerce is mostly the replaced by the quick commerce, right? So now even there is a terms called the live commerce, right? So
Yes.
in the UK, I think the TikTok tried something called live commerce.
Yes.
So there's somebody connected with their the famous model or the fan
Yes.
connected the models, and then during that TikTok live, actually they sell entire product over
Yes.
there,
Yes.
right?
It's happening in China. I mean, people are
True,
going crazy
true,
with
true.
live commerce. Yeah.
True. But when we put into the healthcare is very, very different, right? So in the mostly if I put into the way in the e-commerce, it's mostly like good to have items, right? So what you are going to buy into the e-commerce, mostly what you will be required, but then that is not that urgency, right?
Mhm.
But in the health commerce, when we talk about the e-commerce in the healthcare, it is more of the need base, right?
Yes.
Why do I go to any of the healthcare websites or the mobile app? Because I need the service. Now there is the difference, right? When I go into this platform, right, so the provider has a whole responsibility that how they guide me to get me treated, right? It's not just buying the medicine, right?
Yeah.
Now especially when we are talking about Dubai and the UAE, right? So there are regulator are watching very, very closely how you are caring for the people,
Yes.
right? So the e-commerce, health commerce is more in the care commerce. We can say
Care
as a care
commerce.
commerce.
Okay.
It's not just
Nice.
the electronically orders, but then this has an entire life cycle pattern, right? So
Mhm.
the if I go and book the appointment, not just booking the appointment, my then the further consultation, it may be a remote consultation
Yeah.
or the on-prem consultation, right? In hospital consultation, and then I have advisory from the doctor. I'll have to go
Mhm.
with the different diagnostics or the test, right? And then finally the doctor decide, okay, after basis of this is what the medicine you have to take,
Mhm.
right? So even after taking the medicine, it doesn't end there, right? Because I
Mhm.
have a follow-up for after a week that I need to see how this medicine are reacting my body
Yeah.
and whether I'm being improved or I need to go for the different state of the
Mhm.
treatment, right?
Mhm.
So that's the bigger difference, in my understanding. See, we started, to be honest, that time everybody used to think about appointment request when I joined the Esther.
Mhm.
So we introduced in 2017 that book appointment
Book an
online.
appointment
So there
online.
are a lot of the concerns. The people are saying, oh, they know our doctors, our slots, and
Yeah,
I
yeah.
said, now I always used to give that example, right, guys? Do you want to be a Kodak, right? See, that they will know anyway. If they want to know that how many doctors are treating how many patients, right? So
Yeah.
the other competitor has a lot of choice. They not just rely into the your online appointment system. But what you are getting from online appointment system is that that is massive, because you don't need to wait into the call for the the minutes or the multi minutes. You don't need to be in the dilemma whether I will find the doctors or not, right? And then it doesn't stop there, right? So that is the time we introduced something called the patient portal. So the patient portal was not just the login access, but it is complete care, right? So after the appointment, whatever happened, right? So you have all view into the
All
your
right.
own,
Including prescriptions and all sort
absolutely,
of
absolutely.
consultations and patient history, basically.
Most of the time, the difficulty what I see is, if you need to go to any other hospital, what is your option in those time? The printed paper, and if you have a city MRI, just the city or maybe a pen drive, and go to the other hospital. If one paper miss, your entire care treatment in the
Yeah.
continuity will miss, right? So where the digitization, definitely that wherever I go, right, I have my portal access, I can instantly access my records, I can then present to the doctor, because that is what the differences into the healthcare, digital health, and the digitalization of the any other thing, right? So when we digitize the healthcare, that you get the lot of information, So being work, although I was working as a technologist, but in the healthcare, the any treatment, right, is the 80% contribute is the patient or the
Okay.
person, right?
Okay.
So if the doctor get to know your history, doctor get to know your treatment, the previous treatment, doctor get to know,
It's much better.
yes, what are the your previous symptoms, they can diagnose you much
Yeah,
faster,
makes sense.
versus they doesn't know about you anything, and
Yeah.
then they need to go through the test by test and test by test, right?
Yeah.
So that's how the healthcare is. So to the bottom line, right, in the health commerce is much beyond than the e-commerce. Obviously it's a part of the e-commerce because it's electronically commercialized, but it is actually a entire the closed loop we call in the healthcare. We always talk about a closed loop, right? So if any loop is open, then the potentially there will be a issue in the your treatment. So it's entire closed loop, not just into the appointment booking or the medicine delivery or something, but we are talking about even a couple of months before I had a meeting with the regulatory, and then they're talking about hospital at home now. So
Nice.
these all would be the part of the healthcare commerce, right?
Amazing. So, you mentioned about hospital at home. So, telemedicine has been there for quite some time, right? Remote patient care. So, hospital at home, how different it is from remote patient care?
So the first we need to understand the concept of the telemedicine. What is telemedicine? So the previous days when the technology are not those smart, so doctors used to call the patient through the
Yeah.
telephone. That was the telemedicine
Yeah. Or
actually,
the
right?
video conferencing when the
So
internet was
now
good.
then it evolved into the virtual care. So the virtual care is that even if you are not around, but you can connect. There are so many devices which can actually remotely connect and help the doctor to diagnose, right? So if you have some problem, for example, the very basic thing that doctor do when you go to the hospital is the putting the stethoscope into your body,
Yeah.
right?
Yeah.
So even in the virtual care, we could even connect that, right, in the virtually that
Okay.
somebody is, because there are the Bluetooth enabled the stethoscope.
Sure.
The doctor can guide remotely. They can say, okay, put into this side, put into this side, put into this side, and they can actually hear the actual sound of the the internal body. So
Interesting.
now after the virtual care, because virtual care again is limited, you can have a consultation, but most of the thing either then you have lab at home, you have a pharmacy medicine delivery at home, right? But then still there are certain scenario that you need to come to the hospital, right? Now
Yes.
when the hospital at home is more of the, everything you can do at home. I remember the
Got it.
word, my previous employer, the Esther chairman, Dr. Azad Mupan. I've been part of that. I was quite lucky to be a part of the, his team in the innovation.
Yeah.
So 2019, I believe, 18 or 19. So I've been part of the Global Innovation Summit, which happened in Kerala.
Okay.
And he was obviously, he's a known, the figure in the industry. So he was the guest, or the VIP guest there. And I was, I was, listening his speech. So that now I can relate. What he used to say is, in the old era, in the 90s, let's say 90s, 90, 70, 80,
Mm-hmm.
the doctor used to go home, right? So
Yeah.
there are no concept of the hospital,
Yes.
right?
Yes. True.
And
True.
because that time, because there are no such infra, so
No
if
infra, no
anything
clinic,
happens,
no
right,
hospitals.
so
Yeah.
the doctor used to go at home.
Yeah.
And then we evolved. Now the people is started coming to the hospital. Now we are going back into the same concept, right? The doctor at home, but it is with the technology, right? So
Yeah.
now, if you compare with the 90s, right? So the doctor diagnosed into the home would have been, much less impacted or the impactful as compared to today's, because when the regulator talking about the hospital at home, they are not just looking about the connectivity. They are even looking. So I was so amazed. See, that is what the Dubai is, always, beyond. They think beyond the point, right? So when everybody stop thinking, the people in Dubai, they start, exploring those area.
Yeah.
So in the hospital at home, so they even make the mandate that what kind of bed you have to use for.
Mm-hmm.
And you don't believe that those all bed has a sensor, and while the person is lying into the bed, you will get all the readings from there, right? So what is your sleeping pattern, what would be your other body parameters, the connect. So you don't need to always attach the
Yeah.
sensor into your body, but then even if when you are sleeping into the mattress, you are getting those the outcome. So of course hospital at home is definitely a future, I believe, right?
Mm-hmm.
Because today everybody is busy, right?
Yeah.
So now, obviously, healthcare is a need, right? When it's a need, then you are
Mm-hmm.
going into the hospital. But if you see this is not the healthcare.
Yeah.
We are actually calling as healthcare, but it's sick care, because when you fall sick, then you are going to hospital, you are
Yes.
getting treated, right?
Yes.
The true healthcare would start from home. So that is where now the wearable technology is, right? So those are the preventive care more
Yeah.
we are talking about.
Yeah, yeah. It's crazy to see, I mean, where technology is heading. I mean, I could relate to what you said. When I was born, my father, he used to share some stories wherein I was sick after my birth, and he went to the doctor clinic. He took the doctor along with his suitcase, and it was raining, and it was water like this deep. And my father took the briefcase, and the doctor was walking along, and then he kind of gave me the treatment.
Right.
And again, things are working in a similar fashion, but this time with a lot of technology and a
Not
lot
with the
of
briefcase.
innovation.
Not
Not with
with
the
the briefcase.
briefcase, of course.
Maybe with the iPad or the tablets, right?
Amazing,
Yeah.
amazing. Yeah, yeah.
Yeah.
So fantastic to see innovations happening in healthcare. So talking about innovation, let's talk about another buzzword in the market, the thing which is artificial intelligence in healthcare, right? And again, I want to understand from you, what are the use cases of AI in healthcare? We are talking about AI in e-commerce when it comes to personalization, when it comes to giving that personalized experience to the user, but healthcare is more about patient care, right? So how do you think AI growing in the healthcare space, and what is the future of AI, and what is the impact AI is making in the healthcare industry?
Yeah. I think that today's is AI is very much required in the healthcare. You know, so if you go and see the WHO data, there are acute crunch into the healthcare professional, right? So there are so many countries where the doctors are acute short into the doctors and the nurses and the other paramedics, right? So The AI in healthcare is not to replace anything, right? So definitely it is more of the assisting. So, but we are talking AI today. If I remember back, right, 2017, 18, we were, talking about the CDSS. It's called the Clinician Distance Support System. This typically AI again, right? So that time this buzzword was not there. You rightly
Yeah.
mentioned it's a buzzword, right? So today everybody talk about the AI. So
Yes.
AI do this, AI do this, AI do this. But technically, see, even if we are into the the path of the AGI, right? Uh, Still in the healthcare is far behind, in all those discovery, right?
Right.
So in fact, when I was working previously, even today, I'm working with my new organization, right? So where the kind of a care pathway we are talking about, right? So those are how the care pathway should work. The care pathway should work with the more of the prediction, right? So it would be mix, right? So you have, it's like a augmented reality. So you have a
Yeah.
virtual reality, and then you have a mixed reality kind of thing, right? So it has the person history or the treatment data, right? And then what can happen if this from today's point, right, in another 5 year time or the 10 year time, with the trend of this data, what may happen and how to prevent it, right? So this is where the smart decisions, right? So it's smart decision support system now. So the now more than the CDSS, it can go with the SDSS. So like the smart decision support system, because CDSS is more of the kind of a Q&A, right? So you have multiple questions and you have
Yeah.
a 5 answer. The clinician has an option to choose one and go on, right? But the SDSS can be more of the smartly, suggest the doctor, hey doctor, I have seen the patient history of the 10 years or 5 years. Basis of that, so these are what the impactful treatment process you can go through,
Interesting.
right? So obviously decision will be taken by the clinician only. The AI cannot take the decision, but
Yeah.
AI can always help the
The
doctors.
doctors. Yeah.
Now, putting that into the health commerce, right? So the health commerce, it has a very good potential, you know. So we tried a couple of options earlier, right? Now the personalization of your data, right? You will always feel, good when you are in the hospital, but when you come back into the home, that you will have a lot of anxiety. What will happen? So after 5 days in the follow-up, what is going to discover, right? Now, just imagine that, through the health commerce, that the everyday progress in the patient hand, hey, basis of the last treatment, right? This is what your progress. So you are improving, or you are, deteriorating, or you
Yeah.
are, the progress is steady, right? So something that, the health commerce with the AI can definitely be a game changer for everybody, because everyone doesn't understand how the healthcare work it, how the parameter to read. For example, you go to the hospital in your outpatient setup, you give the sample, but then the reports always come later, right? Because there are very few tests, where in an hour and so that you will get the results.
Yeah.
But otherwise, with the load of the hospitals and the volume and all, right? So your results is always out after 5 hours, 6 hours, 8 hours. There are even the in the scenario like the culture and sensitivity results that comes after 4 days, 5 days. In the
Yes.
biopsy results that goes even after the 10 days or
Yeah.
15 days, right? So depends on the test. So now when these reports comes to your hand, right? So 90% people, they are just, they don't understand what is it being written, right? So this is the range, there is the value. Now this value is some is in between of the range, which is some values are beyond the the maximum limit or the minimum limit. But
Yeah.
now, being a person, non-medical person, I cannot understand what is this meaning,
Yeah.
right? So am I absolutely fine, or am I getting into the some, the big trouble into the health or something, right? So the interpreting this lab results, right, and the telling to the person, hey, this is your result, but don't worry, right? So this is usual, right? If these
Yeah.
are in the borderline, you are absolutely fine, but then your doctor has a prescription. So those prescription are going to help you to, improve it.
Yeah.
Or if there is something that which is unusual, it can say, hey, you need to immediately seek an appointment with the doctor, because I feel that on the basis of this result, your health doesn't looks good. Now, these are the comfort level, the AI can give to the people, in the health commerce. And then when they say that you need to look for the appointment, then go book the appointment right away from there, and then get into the hospital. If it's an emergency, the right way you can tap and call the ambulance,
Yeah.
right? So instead of you are going into phone, searching the what is ambulance number and all, right? So this is what the AI can help into the health commerce.
Sure. I think on the patient side, there's a lot of use cases, as you rightly mentioned, wherein the AI is bringing that intelligence and faster decisions to improve the patient experience. On the operational side, I mean, let's talk about doctors and lab technicians who are, according to me, the least techie people out there. They still like to go the conventional way. Do you think there is disruption happening on the operational side to improve the operational efficiency?
Absolutely. Yes. So I remember almost 3-4 year back, we implemented one tool which was again it's called the CDI, right? So the clinical documentation integrity,
Okay.
right? So unlike into the other like our home country, right? In the UAE, it is 99% almost the treatment is covered by the insurance, right?
Okay.
Now, this is one part. The second part, obviously, most of the hospital into the UAE are connected with the HI, that's the Health Information Exchange. Some are with the Riayati, with the Northern Emirates, with the Nabid, into the Dubai, and then you have a Malafi with the Abu Dhabi, right? So now, whatever doctor writes, right, whether the statement justifies or not, there are the two side of the authority are looking very closely. One, the payer, the insurance, if you are not justifying the treatment, they will not pay.
Yeah.
It is a loss for the hospital for sure. And at the same time, if your treatment documentation doesn't justify, the regulator are not going to leave you also, right? The regulator also are seeing there, watching there, because they want to make this safe haven into this country, right? The medical treatment, when somebody talk about Dubai, even today, obviously, for me, if you ask me, if I talk about healthcare in Dubai, I feel very, very comfortable because I have seen how regulators are regulating
Yes.
the
So when you
care.
say regulator, is it the DHA, for example,
DHA,
in Dubai,
exactly,
it's
exactly.
Dubai Health Authority?
Exactly.
Okay.
So for in Dubai, it's DHA. We have MS into the Northern Emirates, right?
Okay.
And we have Abu Dhabi Health into the Abu Dhabi, right?
Okay.
SEHA, they call it SEHA into the Abu Dhabi. So for doctors, obviously, it is a pressure also. And at the same time, in the most of the private hospital, you have a very short window of the appointment, right? So the maximum 15 minutes. In the 15 minutes, you need to understand the patient context, you need to prescribe the patient, and you need to justify the documentation, right? Now, if you don't have a right tool to help you, then definitely those documentation can go wrong, or I will not say wrong, but then it can be incompleted, right? Or so that is where the CDI was there. So for example, if doctor says the patient come with the the pain, the abdominal pain, right? Now in the insurance, you'll have to really justify the lower abdomen, upper abdomen, right side, left side, right? So this CDI will say, hey doctor, you write the pain, abdominal pain, but you need to specify the site.
Especially from a insurer and the authority perspective.
Exactly.
Okay, amazing.
Exactly.
That's a
So that is what the AI role, right? So we implemented a couple of years back when the AI was not boom, right?
nice.
So similarly now in the operational side, so it is again a big the worry for the administrator, that what is your no-show percentage? How many people are keep on booking the appointment and they are not showing up, right? So the understanding the people behavior, right? What is your total turnaround time into the hospital, right? And which area is likely to take more time, right? What is your total footfall into the hospital, and what is the rush time that you need to prepare with the more the care providers or the customer care people or the billing process, right? And then now going into the payment side, right? What is your payment? The days, like what is the high likely to rejected items, right?
So the business intelligence side of the business.
Exactly. So that is where the couple of days back I was discussing with my team, right? We in the healthcare we talk about the CDSS, right? So that is the clinician decision support system, which is only focused into the clinician. Why can't we make something called the BDSS, the business decision support system? So what is business decision support system? It will be completely in a mix of the the Kilson Decision Support System, you will be a BI, you will have AI, right? So I used to always talk, the AI plus BI is the CI, right?
True,
So
true.
the your artificial intelligence and the business intelligence, when you combine, then you can get the clinical intelligence into the hospital.
Yeah,
So the BDSS is something that So for the operational side, I think there are huge opportunity where the AI can help, because not just to make the money, right, but just to see the care quality also, right?
sure.
So which doctor is taking how much time, which nurse is taking how much time.
Hmm.
If they are taking time because the same process or the same kind of the diagnosis, other doctors is taking less
Hmm.
time.
Hmm.
So there is a scope of the education also,
Improvement.
right? So
Yeah.
the doctor can they can have a cross education. So lot of prediction again, that if I go back into the previous scenario, the appointment book. So most of the hospital, the appointments are revenue, right?
Hmm.
And even for the doctors, right? So they plan their day basis of the number of appointments. Now, if there are regular, the no-show percentage, if they know, this kind of people, when they book the appointment, they are likely to have a no-show, they can actually have a substitute appointment in
Yeah,
that,
yeah.
right? So the other
Makes
people
sense.
can get treated.
Makes sense. Makes sense. I really like the concept of AI plus BI is CI.
Yeah.
Let's talk about data sovereignty. Specifically, in this part of the world wherein every country has their own data residency laws. Saudi has got PDPL, UAE has got federal decree law, right? And then Bahrain and Oman and Qatar, they're all coming up with their own data residency laws. And when it comes to patient personal data, that's always considered very, very sensitive information. So, could you share some insights? How is the data sovereignty moving from a GCC context?
So see, the patient data is always confidential, right?
Mhm.
Because why, I'll tell you, right? In the layman language.
Sure.
So if I know what is your weakness,
Mhm.
right? So I think I can quickly break you down. So similarly, the healthcare is a weakness of your body, right? The healthcare data is not just the your behaviors or your other terms, but there is a say, right, that the money can you can earn back the money. Respect may also, you may earn back the respect, but the health one, once it's gone, right,
It's gone.
there's a less chance of getting back,
Yeah.
right? So that is the reason the healthcare data is more sensitive than even the financial data, right?
Mhm.
So now putting into the UAE context, so UAE has a definitely a very very strict rule, right? So the data residency law, so your data should be within the country. That's the first law, right?
Mhm.
And then there is a data privacy law again, right? So
Okay.
the your data, so without the consent, see, the first of all, so if you see in the UAE, it is very beautifully designed. In the
Mhm.
Dubai Health, they have a mandate. Without having the patient consent, you cannot even enter the demographics data. This is the actually thumb rule from
Mhm.
the DHA, right? Then when you have a consent, you need to specify what are the data you are collecting, how this data is going to be used,
Mhm.
right? And then this data, before disclosing to anybody other than the authority, obviously for the authority, you have to transfer the
Mhm.
data. Even in that point, the NABID, they have given something called the opt out. If I don't feel to sharing my data, I can go and I can say I want to opt out,
Okay.
right?
Interesting.
So this is the level of the comfort that the
Mhm.
authority has given
Sure.
into the data sharing. So
Mhm.
it means now you can understand what is the importance of this data, right?
Yeah.
So there are strict law.
Mhm.
If any of the present data is being leaked intentionally, unintentionally, right? If somebody go and raise the complaint into the DHA, so you may get the fine up to 50,000 dirham.
Wow.
Right? So this is obviously, in the Dubai, many people may take differently, but then I like the way they are putting the fine.
Mhm.
You know why? Because to make the people disciplined, right? So, and those fines are, if it's a smaller fine, the people who have money, they can
Yeah.
just pay and they can
True.
go, right? Like in our countries, if you see, even
Yes.
if there is a fine, there is a way of going out. But here, there's a very very strict
Yeah.
rule, right? If you are following the right practice,
Mhm.
you don't need to pay a fine.
Yeah. Yeah.
But
And
if you are not, then you. So again, coming back into the data. So now if I say you, right, so like the consent is something that is just a mutual understanding, right, but that still doesn't limit you to share your data. That is the reason since 2 year I was talking about the web3. The web3 is something that the decentralize of your data. Now the as a patient I should have an option to share the data, give the permission who can see my data, and I should have an option to revoke at any point in time if I feel that my data is not going into the safe hand, right? So so that is my personal beliefs, right? The web3 is something I'm a big fan of the web3, and in fact I have been working into the web3 for the healthcare data. So the mostly the patient portal and the patient application, the providers should actually move into the web3, right? So that can give a lot of comfort to the people, right? In the healthcare mostly it is trust. And then the second
Yes.
point is obviously when we are coming into trust, right? When I know that my data is safe into this particular hospital or in this particular region, right? So I may prefer to go for the all the treatment for not just for the sick care, but for the healthcare also, for the preventive health also. I may be more comfortable to go and do, right, because I know that my data is within me only. But so that is where the data residency or confidentiality, right, data sovereignty. So this is why it's important, because it's not just to make one rule but also to give a comfort to the care receiver.
Yeah, makes sense. And as you mentioned, the core of everything in healthcare is patient trust, right? Still, a lot of brands, they want to be innovative, they want to embrace AI and Web3 technologies. And I was talking to a big pharmacy chain in Kuwait, and they happen to be our customer. We are building e-commerce for them. So they were discussing a concept called virtual pharmacist, wherein, me as a patient, I can come online, I can chat or talk to the pharmacist, and I can ask all sort of questions related to my health, my skin. But I fundamentally believe there should be some guardrails in healthcare, wherein if this requires a clinical expertise or a doctor consultation, the chatbot or the virtual experience should be able to hand it over to the doctor. But I've seen a lot of chatbots wherein they're giving wrong information. Even if you go to chat gpt, you upload your medical report, it gives you all sort of analytics. But the moment you say, this is something that you missed out, and then chat gpt is like, oh yeah, 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 I forgot to mention that. So the point I'm making is, while all these brands are embracing AI and leveraging all these technologies, still, do you think it's a long way to go? So the question here is, where do you see this going in let's say next 3 to 5 years? And also talking about patient care. So this entire digital ecosystem that is being built in healthcare, how it is making sure that patient care is at the core of everything that they do?
Right. So I'm a big believer of the any of the healthcare solution you build, right? Don't build like by AI by design, or
Hmm.
the see, of course, the security by design, privacy by design, those are the fundamental you cannot compromise,
Yeah.
right? But one big thing many people miss is something that trust by design, right? So whenever you design your applications, any of the virtual application or the healthcare application, it has to be trust by design. So that when the people trust, and then they adopt it, right? If they don't trust, then whatever by design, AI design, or
True.
whatever design you
True.
do, right, they will not adopt it. And you very rightly mentioned, right, in the ChatGPT or any of the AI you go, right, today, so they are very very premature, right? And then this is something like kind of a honey trap, I would say. Many of the people I have seen in the hospital also, people just search into ChatGPT and coming and shouting in front of the
Yeah, yeah.
doctors also,
And
right?
then they start becoming doctors
Yes,
themselves.
yes. So the practically, see, these tools can give you the brief idea, right? But then those cannot make a decision. That is where I started from the beginning, right? When we implement the technology into the healthcare, the AI, what we call, we used to call as a CDS, it's the clinician decision support system. It can actually give insight, but it cannot be a decision maker,
Yeah,
right?
yeah.
So none of the AI today, we are talking about the ChatGPT or Cloud, or you talk about Gork or the Gemini, anything. Those are very, very premature into not only the healthcare data, every
In
data,
general as well.
every data,
Yeah.
right? If you are asking very complex math question, none of this the chatbot can answer very correctly. And you go back and you see, just out of the context, my younger son is just at 11-year-old. So he might be hearing from his friends. So there's some math, practice he was doing with the ChatGPT. And then in the evening, I got the message from him. He was so furious. He said, "Papa, this is so stupid." I said, "What happened?" Then he said, "See, given this answer, but then I was guessing it is not the right." And I said, "Is this really right? Isn't it this?" Then they said, "Yeah, you are absolutely right." So if I'm right, then why should I use this?
Yeah.
So then I laugh and I said, "Yeah. So this is why I tell you, don't use the ChatGPT for your study. Your teachers are much smarter, right?" So now, when I was say the honey trap, right? Because these tools, in some of the context, they give you very nice answer, and the people tend to believe it, right? But not to again put. So in the August, my mom got into the accident. So I have to rush to my hometown, and she has the complete acute fracture into the hand. And she was into the government hospital, it's a remote area, right? So there are no other hospital to get into that time. So, but that time, I started uploading the photos and all. But that time, it gave me a very right advice also. So, but then it doesn't mean that it always give you the right advice, right? So for the general questions, it can give you the right answer. But when it come into the health, how to diagnose, how to prevent and all, you cannot blindly trust the chatbot, because
Absolutely.
they are also just evolving now, right? So they are into the learning mode. So now for the true healthcare into the AI, in next, see, today we cannot talk about 5 years. 5 years is long run, right?
6 months, 1 year.
Exactly. So honestly, in the year time, the many thing will change, right? So just 2 days back, I was reading one article that China has unveiled completely the AI hospital,
Okay.
and literally there are robots.
Is it like live already?
Live is live.
Wow.
So literally there are robots, and those robots are actually talking like the human. You can go, you can tell your problem, right? But only thing is, obviously, so in the healthcare always cannot be in the autopilot, right? So it has to be human in loop, right? So that is what concept we always believe in. So there are obviously in the control center, the command center, there are qualified physicians, right? So they can always watch out what the robots are actually giving the advice. But then yes, so this is what we are seeing today. So in another year time, your healthcare can be drastically goes go toward the AI, and the AI is definitely going to disrupt the market, right? So I remember one of our the previous organization, one of the CEO of the organization, he was in 2019 we had the technology summit, and in that we invited him as a guest speaker. So he was giving one example, and I still feel that that is what he was predicting in that time. So he was saying, today if anybody see who is the best bank into the country, that if I have a 5,000 ATM, then I'll be the best into the country, right? Because I have accessibility. But if you see after 10 years, whosoever bank has a zero ATM into the street, they will be the best bank, right? Because so that is where the technology adoption.
Yeah.
The same thing is going to happen into the healthcare also. So today you have a lot of outlet, but the people are getting habitual of getting the treated things into the home, right? So in another couple of years, you'll have technically very less hospitals, right? So the more of your preventive health, and then only for some trauma or some other critical cases, the people may need to go to the hospital. So if you are seeing those days or if we are imagining into those days, so then the AI is the only way that that can help, that can bridge the people, right? So being into the home also, and it's not a very far away, to be honest, Anurag, right? So even we are doing some R&D, right, where in the your mobile app or in the your like kind of your Alexa or something, right? So the device at your home, which can actually be your friend, your companion, health companion, right? It can actually see your behaviors, how you are talking, how you are actually spending your days, and basis of that, it can actually give you the personalized the care plan, and at the same time it can even connect with the care providers, and then the care before you fall sick, the care provider can be at your home. So that
Amazing.
is what the future
I mean,
is.
it's mind blowing to even imagine, a hospital which has got robots and AI,
Right.
and it's not just the software developers who might lose job in case they don't embrace AI. It's the doctors as well.
So I think so this part always I have been hearing this since many days, Anurag. The AI then disruption, the people will
Yeah.
lose the job. Yes, it's true. People will lose the job, but those who are not upskill,
Yes.
right? So the it's a I think the law of the nature also, right? You have to
Absolutely.
keep on
You
upskill
have to
yourself,
evolve. I
right?
mean,
You
you
have to
have to
evolve,
improve and upskill.
right? So if the monkey evolved to the human, right, the human has to be evolved as a smarter human,
Absolutely.
right? So if we are not putting the effort to understand what is going into the market, how my work will impact in another 5 years, then I think definitely those people will lose the job. But if you are into up to date into all this area, right, so definitely you will not lose the job, because the one kind of job may be obsolete, but then there are so many new opportunities, right? So if we see the before computer era and the after computer era, right? So when we have a more job, after computer era, you have a
Absolutely.
huge job,
Yeah.
right?
And then
But
this was .com bubble, and then
exactly.
everybody
Now it's AI
grew,
bubble,
right?
of
It's
course.
the AI. I think it's not a bubble anymore. Maybe it's a reality now. And people like you, who are working on super intelligence and who are already ahead of the curve. I mean, this is the future, right?
Absolutely, this is true. But then, if you see the market, right, there are anybody and everybody. If you see the everybody say this, there is AI, there is I have AI. So a couple of days I had a discussion with my previous organization CEO. So he was saying, okay, tell me, Padam, which are the best AI into the market. So I said OpenAI. Then
Okay.
he was quite surprised. He was saying, "What are you saying?" I said, "See, today if you see anything, the Cloud or the Gemini or the LLM or the Gork or anything, see the base is the OpenAI. The everybody actually posts from these companies, and they are rebuilding the AGI. Today, if you are talking about the artificial general intelligence, right? So they
Yeah.
are they are the one who is making it.
Yes.
So the base is that, but now how well you will train, right? It's the same thing that you can have a 2 3 puppy in your home, right? So how you will train them, right? So they will be
That's
acting like that.
the
So they
difference.
yeah, AI is that. In the super intelligence, yes, definitely. My research is into the super intelligence. But only when I talk about the bubble, right? So because there are so many companies, they say I have AI, I have AI in the healthcare. When I used to be in the head of technology, so many people used to approach me saying that I have the clinician decision support system. I have this data model, this data model. Then at the end, when you ask, yeah, in the back end we have OpenAI. So,
True,
so
true.
that is what the bubble is. So
Yeah.
many people don't think beyond the chat GPT today. But then there is a so you can use the chat GPT, you can use the cloud, anything these tools. But then with that, don't depend on them, right? So build your
Yeah.
own ecosystem, which can be much more smarter,
Sure,
right? So
sure.
that will actually burst your bubble for sure.
Amazing, amazing. So, Padam, what is that one final advice that you want to give to all these healthcare brands and healthcare organizations out there who want to embrace technology, who want to embrace Web3, you know, before we call it a wrap? So, I want you to kind of give that one piece of advice that uh, can be a takeaway for a lot of brands out of this podcast.
Sure, sure. Use the technology where it really need. Okay, so there are so don't use the technology for the fashion or the show, right? So because most of the people I have seen that, we need to adapt the AI, but for what you are adapting the AI, right?
Hmm.
If the AI is really required into your workflow, please adapt the AI, but just for the namesake, don't do that, right? So use the technology. You have to the upskill your people. You have to upskill yourself, right? Be secure, because today when we are talking about the AI or the digitization, many of the organizations, they are just forgetting the cyber world, right? The cyber security. You have to have a security by design. Anything and everything, you have to ensure it is security by design, privacy by design, and then, as I said, the trust by design, right? So if you are taking this care first, and then you can actually implement any use cases into the area where actually it can solve the problem, right?
Yeah,
So the technology is something, or innovation, when, because I used to work as a head of innovation also, right? So it's my philosophy again, the innovation is something to solve the problem, right? It should
absolutely.
not create the problem.
Yeah, yeah, yeah. True, true. I mean, that's one of the best advices I've heard so far. Definitely agree to the fact that, a lot of brands, they're, just to be visible, they are embracing a lot of technologies. But as you rightly mentioned, there has to be a need. I mean, a problem has to be solved through technology. So I think it's a great end to the podcast. And my personal takeaway from the podcast is the fact that you spoke about AI and BI creating the clinical intelligence, and trust by design, which has got trust as the core component. That's another takeaway from my side. So thank you so much for joining the podcast. It was lovely having you, and thank you for sharing all the insights with us.
Thank you, Anurag. Nice to be your guest into the podcast.
Pleasure, pleasure, Padam. Thank you
Yeah,
so much.
thank you.
Today's conversation made one thing very clear. The future of healthcare commerce isn't just about digitization or automation. It is about building trust first platforms where AI enhances the outcome, data sovereignty is respected, and technology works at the service of people, not the other way around. Padam, thank you so much for sharing your insights and perspective. And to everyone listening out there, keep learning, keep innovating, and let's build the future of e commerce together.